Welcome back to 41 Today Lifestyle, everyone. I'm over here with Dr. Harrington and Dr. McBride from Surgical Associates of Warner Robins, and we're talking all about hernias, the signs that you may have a hernia and what we can do to fix it. Welcome to the show, guys. Thank you for coming back. Okay, I told you in commercial break that I've had two hernias, everyone. One when I was 12 and one when I thought I was about 24, 25. The first one hurt a lot more. Why is that?
Because you had no idea what it was.
I know, I thought I was dying. I literally thought I was dying. I want to ask you, just before we get into all the specifics, what is a hernia?
So the hernia is a bulge or defect which is caused by normal tissue or organ protruding through the otherwise wall which is designed to contain it.
Okay, I understand. And it's normally in the groin area, or can it be happening in the stomach as well?
It can be anywhere in the abdominal cavity.
Really? Mm-hmm. That I did not know.
We see a lot of umbilical hernias, inguinal hernias, previous surgeries, or just sporadic hernias can occur.
Really? Because I watch a lot of that, you know, marvelous medical shows, and they're always talking about they've gone in and they've found these huge hernias. Can you be born with a hernia, and is it hereditary?
You can be born with a hernia. Does tend to run in families. Children can have various types of hernias from the time they're born till the time they die.
Okay, I got you. Now, if we discover we have a hernia, what are the symptoms of knowing we have a hernia?
So typically the patients know because they notice there's abnormal bulge or lump, but a lot of times it's associated with pain. Mm-hmm. Discomfort, the activity just becomes more painful, normal physical activity, and sometimes if there is an organ involved, like intestine, it can also disrupt the digestion.
Oh, so you're going to know if you're having a hernia issue.
Oh yes.
We discover we've had a hernia. We have one. Mm-hmm. How soon before I need to see a doctor or a surgeon? Could I put it off for months or?
You've got to be careful because the biggest problem with the hernia is if you get something caught in the hernia and say it twists. Larger hernias are actually less likely to cause a problem, but the larger hernia is, the faster it's going to grow. So you really need to have it, need to consider fixing it as soon as you can get in and have it performed electively.
How do we fix it? Apart from the operation that I had, because you know, you were talking in break about a mesh, or are we cutting us, like, explain the situation.
We don't cut it out. That's a misconception, but we essentially, since the hernia is a defect, typically in an abdominal wall in a muscle, so the plan is to basically to patch the defect and also repair it at the same time. And the way to patch it is typically with a mesh, although there are exceptions.
So, I'm just trying to give everyone a visual at home. It's a lump that comes out, so you're pushing it back in. Correct. And then putting the mesh over it to keep it there?
It's more like patching a tire.
Okay, yes, I got you. Mm-hmm. What happens if we don't do anything about it? What happens?
It could be a problem.
Such as?
So the hernia will not get better.
Yeah.
It will at the best stay the same or get larger, and that could be a problem. If you have a large defect in the center of your stomach area, it may affect your ability to breathe, to move, and it's cosmetic deformity, and
you're going to hear or
problem.
Feel that you have a problem, right? Mm-hmm. You guys are such great information. Will you come back and give us more?
Love to.
Sure. I'm really enjoying it. We've talked about many things already. Appreciate both of you coming in. We don't want to take up any more of your time. If you want to find out more information about Surgical Associates of Warner Robins, there it all is up on the screen, everyone. Give Dr. Harrington and Dr. McBride a call. They'll take care of all your surgical needs. Back up to this short break, everyone.